For more on this, we welcome Nebraska's 1st District Congressman Jeff Fortenberry here to News Radio 1110 KFAB. Congressman, good morning.
Good morning, Scott. Thanks for having me on the program, and thanks for being very diligent about the reporting on this. You were way ahead of this before the pandemic really accelerated, so I'm grateful for your willingness to stay on top of it.
Does it feel like the last 2 months has been at least 2 years to you?
It's an exhausting time for our America because there's so much suffering and, frankly, there's so much uncertainty as we try as a country to align two things. One is to keep everyone healthy and safe, and at the same time assure that we have a bridge to restoring our economic well-being. Both are critical, but it's a 1-2 step that has to take place all at once.
You're right, and these two things give us so much to talk about here in a short amount of time. The first thing we have here is this deal that apparently was reached overnight on the stimulus package. What are your thoughts on this package? What were the nature of the battles between the Republicans and Democrats before anything got to the president's desk? And is this a good bill?
It's a necessary bill. It's shocking, the price tag, but what has happened to us is a shock to our entire system. The way to think about this is in a three-part phases. One is protecting health, 2, protecting individuals and families, and 3, protecting small business. So, again, with the uncertainty that's out there, and with the policies of social distancing and closures taking place, that is all happening. So there's time to provide testing, again, so that our healthcare system is not overrun, as we've seen in Italy, and there are more and more people sick who cannot get care. So all of this is to buy time for us to be able to better treat this disease, maybe find a cure or vaccine, as well as make sure that certain people are well and potentially can go back to work. So the bill, it's massive, but really it moves a lot of money back into our healthcare system for those intentions. It sends a check to most Americans for $1,200, $2,400 for a family, $500 more if you have children per child. And then the big component here is, again, protecting small business. There's going to be a very significant loan program funded here that will work through banks. So banks that are already certified to be small business lenders to the Small Business Administration will administer this program. And basically it gives a loan to anyone who keeps their employees on the payroll. And there's deferred interest in principal on that loan. But there's also forgiveness for a part of that loan for the wages and the rent or mortgage payments that they have to make. So I'm hopeful, again, that these measures, which are extreme and necessary and urgent, buy enough time to flatten the curve, make sure that we are getting well quickly, and then get back to work as quick as possible.
Couple of questions on this. First, from Ma and Pa Main Street across America, when do we get our checks?
Yeah, it's a fair question, and I'm honestly trying to get a better answer on that right now. There's going to be, it's not tomorrow, this bill has not passed the Senate yet, and it needs to go through the House, and then there's got to be a mechanism by which those checks get out of the door. It needs to be quick, it needs to be rapid in order to have the most effect, but what will be coming, again, is up to $2,400 for a family who qualifies. That's most Americans, plus $500 extra per child. I'm hopeful that means days, not weeks, but it may be weeks.
Well, are we going to be able to get the House in session for this? What's the Speaker saying now?
Yeah, this is a real dilemma because members of the House are spread across the country, a number of whom actually have pre-existing conditions that make them susceptible to the disease, some of whom are elderly as well. There are legislative mechanisms by which, if there is what's called unanimous consent, no one objects, then the Senate bill could actually go through the House without us being present. There's another way to do it. It's called a voice vote. For those who are present, they can say yay or nay. But if one person raises their hand and calls for what's called a roll call vote, that triggers everybody needing to be there. This is a huge dilemma for me. I obviously feel the moral obligation as the representative of 600,000 people in eastern Nebraska to be a part of this, but the circumstances are so dire and so dangerous for certain members of Congress that getting everyone back together is going to be a very heavy lift. So it could go through without us being there, but if we have to be there, we're going to get there.
Is that one person who would raise his or her hand? Would that be a member of the House or the Senate or either?
Well, I'm just talking
It would
about
just
the
be the
House.
House. Okay, which
Yeah.
leads me to my next question is we have Congressman Jeff Fortenberry with us here on 1110 KFAB. This question comes from my inner Rand Paul. $2 trillion. Do we have this money just lying around for this? Where does this money come from? I can't even fathom $2 trillion. It's an insane amount of money.
It comes through deficit financing. It's not sitting around. That's a hidden form of taxation that pushes the obligation into the future on children. It sells bonds overseas, and it also potentially has inflationary impact as the Federal Reserve basically gets this money out of the door. Thankfully, inflation has been very low. The reasons for that are absolutely somewhat unclear. America gets away with this ability to borrow because, frankly, our situation, our banking system is stable. Our financial system is stable. We are a currency of reserve for the rest of the world, so people want to buy our stuff, buy our financial instruments. We're the leader in capital markets. So this is how that happens, through borrowing.
You're saying, I'm hearing in your voice, Congressman, that we might not exactly love the idea of having to do this, but nonetheless, we have to do this at this point in the nation. Is that a correct read on your tone?
Yes. This is emergency. It's a crisis. It's going to take all Americans pulling together and sacrificing, which so many have already done. There's so many beautiful stories out there. I'm sure you're hearing them, of business owners who have gone to great lengths to keep their people on the payroll, providing cash, providing money, neighbor helping neighbor, and on and on. This is one of those moments. The government has to step up. There is no other mechanism but here by which we can meet the healthcare emergency and fund our hospitals and work toward a cure, and at the same time keep particularly small businesses going as a bridge until we can get past the epidemic, control it enough that people are safe to get back to work. This is the highest level of what you would call a public good. It absolutely requires governmental intervention. We're the only mechanism around by which to create stability for our country, to create cures, and to protect small business. It has to be done.
I have 2 emails here asking whether or not Republicans will have the opportunity to read this bill before we pass it. The phrasing, "Are we going to find out what's in it after it's passed?" Echoes of Obamacare, which you went through here. Are we going to have a chance to read this before it's passed?
The basic construct of the bill, as I just laid out, is widely known. We have been on multiple conference calls with our own leadership, with other members of Congress. I'm on the Appropriations Committee. We've had a certain role in the dynamic here. So there's been a lot of communications about, again, the idea that we're going to move significant funding to healthcare systems, including state and local government, that we're going to move money directly to individuals who are in real need, and then create the mechanism by which small business can stay in business if they keep their people on the payroll. Plus, if there are circumstances in which people are being laid off, unemployment insurance has been accelerated, and the amounts of money have been increased. Will there be things in this bill that are going to be distasteful, that we all find out or weren't thoroughly thought through because of the rush? Absolutely. There's a lot of money being thrown at a very urgent problem here. Some of it will be ineffective and wasted, but the reality is the moment transcends our ability to get this perfectly, and of course there's going to be significant, serious disagreements philosophically in Congress. So this is probably about the best we can do, but there's going to be something in there to complain about, I guarantee you.
Yeah, but there shouldn't be anything in there that afterwards we go, whoa, I mean, we just had a radical takeover of private hospitals, which your cohort from Minnesota, Congresswoman Omar, is talking about doing now. There shouldn't be anything that is a radical sea change from how we do things in this country, hopefully.
Well, over the last couple of days, you heard some conversation about this bill becoming a Christmas tree full of ornaments,
right,
of ideological fervor. It's my understanding that most of that has been excised, removed, thankfully, and we got back to the basics here, protecting health and protecting individuals and protecting small business.
Well, we started this conversation, and we just have a few minutes left here with Nebraska 1st District Representative Congressman Jeff Fortenberry with us here on News Radio 1110 KFAB, talking about providing for the public safety, the public health, but also not letting our economy go into such a deep depression that it takes years, over a decade, to get out of. And that's where the president's been talking. We have some bright signs on the world economy. China is allowing trains here in the next week or two to go in and out of Wuhan, where this started. But at the same time, Italy had an uptick in new cases yesterday, where they had seen a decrease. Spain now has so much issue here. There's a story, there's so many bodies in Spain that they commandeered an ice rink to store them. India is now in lockdown. That's a huge economy in the world. And our president is saying we need to get this wrapped up here sometime between the end of the month and Easter, which is only a few weeks away. So what's your feeling, Congressman, as we listen to the public health experts and we listen to those who are saying we can't destroy this economy, and we're all trying to figure out the right path here? What's your feeling on how we get this done?
Okay, three things. First is you have to protect health. Our economy is no good if we are sick and dying. But secondly, the cure can't be worse than the disease itself. So if we buy enough time through the social distancing policies and the closures, as painful as they are, to not end up in a situation like Europe, who really didn't listen. Now, Italy is a special case in that they have a very elderly population, but they have a first-rate healthcare system. So you can see what happens if a healthcare system is overrun by the disease. We don't want that to happen. So obviously, if we buy some more time and then we have a surge of testing, so we know who's sick and who isn't, or there may be some regional considerations. You see, this is much more intense in New York than it is in Nebraska. We might have some regional considerations where you have more stringent rules, perhaps in New York than in other places of the country, which have not seen the disease take hold as rapidly. But again, I'm hopeful that the distancing policies, along with testing, along with the possibility of treatment coming along quickly or improving, maybe possibility of a cure, again, buys us enough time with the supplement to small business to keep us afloat, so that all of this aligns quickly, so that we stay healthy and our economy, it's going to shrink. These are negative multipliers in effect now, but we bridge, and then once this disease is pulled back, we roar back. That's the idea. The timing on that, I don't know. This is a sacrificial moment for our country.
People are questioning the president's judgment on this. They're saying he's not listening to the experts and he's going to get us back and lead to a second wave of this. Do you trust the presidents here with what needs to be done in the weeks, maybe months ahead?
Frankly, I think the president has done a very good job in his press conference. He's looked very presidential in command. He's got a great team around him who has projected not just a seriousness of intent, but also a calm, and have dealt with problems as they've arisen. We've not, frankly, dealt with something like this in the modern time, so there's a lot of gaps, and you can critique this or that part of it, but it is a pandemic. It is an emergency. I think communications have gotten better. Hopefully, again, the supply situation for testing as well as other medical supplies is beginning to sort out. These are all the conversations that are going on behind the scenes, though, as we teleconference with one another, as we're seeing individual problems around the country. I've been on the phone quite a bit with both other members as well as key leadership saying, we need to do this, we need to do that. So, look, nobody's got the fullness of the answer. We've got to pull together here as Americans. But again, if the healthcare system can remain sound, we'll treat those and get better at the treatment. Our social distancing will give us enough time to create to mitigate the spread of the disease. And then again, this package is going to help people stay afloat while we suffer through this economically. There's no easy answer here, Scott. You know that.
No.
There's no easy answer.
Well, and some people have already treated it like the president has already made his decision when he hasn't. He's just said, "Is this the sense I have?" And we reevaluate things as we move forward. So it's gotten to be ugly and political again, which I sense is a good thing, Congressman. Things are getting back to normal. We have ugly, venomous partisan politics being played here. A quick question here, and I'll let you go. Kathy asks, what dollar amount will a person on Social Security receive in this stimulus package? We're taxpayers, but may not have earned income. That's from Kathy.
Kathy will get the same check.
Okay. All right, Congressman, I appreciate it. I'll let you get back to work. Make sure that there's no ugly Green New Deal pork in this bill, all right? Counting on you.
We're staying with basics.
All right.
Thank you, Scott, for the time.
Appreciate it, Congressman. We'll talk again.